You are listening to the Liquid Flannel podcast. Thanks for tuning in. I'm Chuck Williams, and joining me back in Nebraska again is Brendan Williams. Brendan, welcome back.
Whew. I'm back. I've been cleaning up tree branches and roof shingles out of my yard for the past week, but I'm back and ready to go.
Yeah, man. Well, you know, that's what happens. Mother Nature misses you and decides to start messing with your stuff.
It's like a cat, you know, like, yeah. You go away for a little bit and it just gets antsy and starts to mess up your toilet paper. And
shreds all your furniture. And as per usual, joining us in Arlington, Texas is the great Matthew Hodges. Matt, how's it going, man?
Hey guys, it's great to be here. I just want to say that I'm going to dedicate my portion of the Patreon this week to the Johnny Depp Rehabilitation Fund. Because here's the thing, because like Kathy Griffin, Johnny Depp is not only a paragon of a human being, but also absolutely speaks for liberals and the left. And I think that this smear campaign against him has been awful. So I'm starting a foundation to help, rehabilitate his image, and I just wanted to plug that here.
He really needs the money too.
Okay. Yeah, definitely. And joining us, a repeat guest again, is Peter Coffin. Peter, how you doing?
I'm great. I actually just started a foundation to rehabilitate the image of Charles Manson.
Oh, man. Son. Oh, man, that would be a great slogan. Oh, man. Son.
It's funny you should say that. I was here specifically to solicit new slogans.
Okay, well, we'll have to work on that. Hit me up on Twitter. So, yeah, guys, I guess we've got a lot to talk about here this week, including some of the healthcare issues from the Senate, right, Matt?
Yeah, definitely. The CBO score just came out about the healthcare bill, and it's not like you're going to hear a whole lot here that you haven't already picked up on Twitter, but we do have some commentary on that.
Well, that isn't the only thing that's been happening. There was recently a good Washington Post article that I'd kind of like to get into here that goes into the Obama secret struggle to punish Russia for Putin's election assault. So some great information in there. Some of it's not too surprising, and some of it's just a little bit more of that same old song.
Well, now, hold on a second, because I saw on Twitter, our president said the Russian story is fake, but how come Obama didn't do anything about all this meddling?
Anything about that fake story, right.
Yeah, what am I supposed to believe here?
It's my favorite Trump position, which is Obama is so incompetent, he got Trump elected, so clearly he's terrible.
He colluded to get Trump elected.
Yeah, coming from Donald Trump, it's the best argument.
So yeah, hopefully we'll get a chance to touch on that and a few more things. So without further ado, let's get to cracking.
The Senate health care bill gives the wealthiest Americans a $250,000 tax cut. The bill reduces tax revenue by $700 billion over the next 10 years, and most of the benefit goes to the top 1% of households. The savings are even higher for the top 0.1%. It's why Republicans have been criticized for shifting money from the poor to the rich.
This to us is something that we're not going to give up on, because we're not going to give up on destroying the healthcare system for the American people.
It's an unbelievably complex subject. Nobody knew that healthcare could be so complicated.
If you've been following the healthcare saga, they were like, we're throwing the House bill away and we're starting from scratch. We're going to build it from the bottom up to make it way better. And they literally did absolutely not that at all. It's almost identical.
Didn't even include until today the really awful draconian penalty for people who have their insurance lapse that was part of the House healthcare bill that actually was kind of a stab at making sure that health insurance in this country is ever solvent.
Yeah.
The individual mandate of Obamacare was not super popular, but it was the only way to make sure that people who had pre-existing conditions were covered, because otherwise people could just jump on insurance, when they,
Right, when they
I don't know,
needed it.
developed cancer or got in a
Right.
car accident or something like that. So the Obamacare said everyone's got to have health insurance all the time or you pay a tax penalty. The House bill said you don't have to have insurance, but when you jump on insurance after your car accident, they can charge you like 3,000% of what everyone else is paying. And the Senate bill was like, we're not going to drop pre-existing conditions. But we're not going to have any kind of mandate either. So then the insurance companies freak out. And, well, this is completely unsustainable. And so now, thank God they've added in this terrible, inhumane penalty.
Yeah, which what it is if you don't have insurance for like 60 days. So if I got fired tomorrow and then was like, oh, I don't have any money, I can't afford health insurance, and then I needed to go get health insurance after that 60 days, they just say, no, you don't get health insurance at all for 6 months.
Right.
Which is crazy.
The thing about the house one, too, is that you could get insurance right away, but you'd pay a surcharge on it for a year. But you'd be covered. Like, you'd have it, at least. It's not something... Like, you could literally be off insurance for 4 months and then get insurance, and that would have compensated for the extra 30% surcharge for a year. But still, you'd have it. In the Senate one, they literally like... Well, yeah, you don't get it for 6 months.
Yeah.
Like, that's bizarre.
And when you do get it after the 6 months, you still do have to pay extra, I believe.
Yeah, there's a surcharge on that.
So not only, could you just not get it for 6 months? Yeah, you're just supposed to be like, well, I'll just wait it out or whatever. Like if you
Walk it
have
off.
diabetes or, something. Because we all know that a system is so much cheaper when you could go get something treated, but you decide to just wait for
Until it's
6
more
months.
serious,
I mean,
yeah.
that's how your health improves
Yep.
and gets cheaper by just waiting it out.
Right.
It's a completely nonsensical, like non-incentive, because if you're going to be penalized by having to wait anyway, you might as well just say screw it. Like, there's literally no incentive because you can just say, well, I'm not going to get it anyway. Like, if you for any reason can't maintain coverage for 60 days, you might as well just wait as long as you can because you're going to be penalized anyway.
Well, the thing is, though, I mean, the thing that we all have to remember, though, as Senator John Cornyn from Texas tweeted today, 28 million uninsured under Obamacare, you guys. That's a big number. 28 million people uninsured under Obamacare. Now, he's also one of the people who's promoting a health insurance plan that would uninsure many more people.
See, there's a big problem with what you're proposing here, and that's that we do math.
It's challenging.
Right.
I mean, all of us got liberal arts degrees, so...
I'll start calling you Math Hodges.
I only do that fuzzy math. I have to respect Cornyn for going out there with some actual facts because
True.
so many other conservative Republicans have decided to just completely throw facts out the window and say, like,
Oh, yeah.
what, this bill cuts $800 billion from Medicaid? Like, no, it doesn't. It doesn't cut any money from Medicaid, and it covers everybody, and it's going to be cheaper.
Yep.
Like, yay. None
more
of that's
freedom.
True.
Monorail, monorail.
Infused with freedom.
Just the blatant lies are so outrageous. And then you've at the same time got people saying things like, this insurance plan will literally cause hospitals and nursing homes to close and throw sick people out on the streets in the gutter to die.
Right, and particularly in rural and low-income areas, which are bastions of Trump support.
Right.
Exactly. Rural hospitals are going to be some of the hardest impacted by these cuts because they take a lot of Medicare patients because in the rural areas, they have a lot of people with low, incomes. And apparently that is too snowflakey
Right.
for the Republicans to handle, right? You can't say, this is going to kill people. Like, let's keep
Right.
the discourse reasonable.
Yeah,
here.
let's cut the hyperbole here, guys, for real.
And there were so many takes about that on Twitter. This one in particular, and I don't remember the guy's name offhand, but he said, there are plenty of arguments to be made against Trumpcare. It's going to kill a bunch of people isn't a rational argument. I'm open to other ones. the thing is, this bill is going to be so bad that the ramifications of the bill are a thing that we can't introduce into civil discourse.
Yeah.
I mean, I didn't know that was a legitimate line of argumentation. I mean, if liberals had known, this whole pro-life versus pro-choice thing would have been over long ago, because
Right.
next time they just start screaming like Hillary Clinton's a baby strangler or whatever, you just be like, whoa, hey guys, like, let's keep it on the civil level here. You
Right.
know, let's not let these debates get too extreme. Let's keep it within the boundaries of civil discourse.
Hey, look, no, and I'm glad that Trump is appointed as his new Minister of Civil Discourse, the Honorable Mr. Theodore Nugent, who is, for one thing, that guy's never gone into, frightening and violent hyperbole. And secondly, I think that his call for civility now, when it's his side under attack,
So brave.
actually, shows a lot of character.
He's the hero that we don't deserve.
And neither did the Vietnam War.
Really, really is.
Right. Well, and Mitch McConnell won't even face his heroes. I mean, that dude had childhood polio and was cured by it, and the group that cured him wanted to meet with him about this bill, and he wouldn't even meet with them.
That's the March of Dimes.
Yeah.
So
Yeah, the March of Dimes, founded during the Great Depression by FDR. The March of Dimes,
right. And it's like, if you can think of a group that should be like a bipartisan, they're not a politically polarized group or whatever.
Yeah, who knew helping kids in polio would be so political, you know?
Well, it's the same thing, because you got Paul Ryan or whatever, who, when his father died when he was younger, received like Social Security and Medicare survivors benefits or whatever that put him through college.
Yeah.
But of course, that has no impact on his desire to let that system help other people.
Well, right. Well, because they didn't deserve it the way that he did. I mean, everyone thinks they're more deserving of these.
Yeah, he had a real situation.
Right. Same with Mitch McConnell.
Unlike all those other cancer patients out there. I mean,
no
they
kidding.
just really need to step up the personal responsibility, as Vice President Mike Pence said in a room full of millionaire donors.
Right.
That we need to build a healthcare system based on personal responsibility.
It was surprising to me, for somebody who's so in favor of personal responsibility, that he didn't respond to any concerned parents of kids who had cystic fibrosis or early onset cancer, or any of the older people who had parents who had dementia and needed 24/7 care. I don't know. I was surprised because he's such a man of integrity most of the time, and he didn't respond to a single one of these concerns from his ostensible constituents. It's amazing.
I agree. Truly an abnormal event. Total aberration.
Right.
The whole personal responsibility argument is just so absolutely ridiculous when, like, I don't know what they think diseases are. I mean, I guess in Mike Pence's case, he literally thinks that if you get any disease or condition at all, that's like a sign from God or something.
That you made bad choices.
Right, that you're living a sinful life, and if you just...
Yeah, it's that same prosperity doctrine, dominionist bullshit that we see, from Betsy DeVos and some of the other people in this cabinet.
Well, didn't you share that Kellyanne Conway's response when someone had said, a bunch of people are going to be kicked off Medicaid, and she said, well, now they can work and get those benefits.
Well, they should just get jobs and cake, lots of cake.
Yeah, because, man, I'm at the height of productivity when I'm rehabbing fucking cancer or a knee injury or something.
I'm at the height of productivity when I'm 11 years old and dealing with a congenital illness.
I've heard that chemotherapy actually functions as speed.
Yeah, seriously.
It's
performance enhancing drugs.
Yeah, it's like taking a 5-hour energy.
Yeah, that's actually what showed up on Lance Armstrong's reports.
I think that's actually what's in the Republican healthcare bill, is just, everybody gets some 5-hour energy and a bunch of billionaires get a massive tax cut.
And also, no raising the minimum wage. What we do is we give them the 5-hour energy, We don't raise their wages. If they're sick, they work anyway because it's their right to work. And they can be personally responsible about their choices, and if they're not, God will give them cancer.
Yeah, that's right. You've got to make the right choice about when in the day to drink that 5-hour energy when you're going from your one full-time job to the next full-time job, because you want to be able to power through it.
Yeah, you need that burst, that real burst that lasts 5 hours specifically.
One of the more insidious parts of the new Senate bill is that it does a pretty decent job at masking some of the, to quote Trump, the meaner aspects of the bill, because it pushes a lot of those negative impacts onto the states.
Yeah. Mm-hmm.
So one of the things in it is that in Obamacare, they had this system where, and Obama kind of said this when he was going out around selling the bill, saying, look, if a state has an idea that can save money and cover the same amount of people, then we can do that, right? They can apply for a waiver and say, we have another system that we'd like to try, and we think based on this information, it might be a more effective option that can cover more people or can save costs. And they would have to submit it and get it approved, and then they could get these waivers. Well, the Senate bill has slightly tweaked that language to basically say, if a state applies for a waiver, they just get it, right? Obamacare had this whole system where they'd have to apply, they'd have to supply information, and they'd have to get it approved through the Department of Health and Human Services.
Yeah, it had very specific requirements regarding basic minimum standards of care, certain services provided, and there is a requirement on the new version of it, but it's literally that it just doesn't add anything to the federal budget. That's it.
Right. The Obamacare had what are called essential health benefits, which were mandated that you had to cover these things. And that's where a lot of the controversy came to, because some of the things that it included were maternity care, contraceptive care, preventative care, chemotherapy, those kind of things. It's like, in order to qualify as health insurance, your coverage has to include all these required
Your coverage has to
things.
actually be health insurance.
Yeah, exactly. Right. You actually have to be some kind of a provider of services.
It's not healing crystals and stuff like that.
So now with this Senate bill, they can get out there and say, well, we're still keeping that. We're still keeping the requirements at the federal level. We're still keeping pre-existing conditions. We're still keeping the essential health benefits until any state says that they don't want to. And then they automatically don't have to do it anymore.
And the only people on federal health insurance are going to see like an $80 billion cut to their coverage. So
yeah, exactly.
It actually works out for everyone. It's like writing the opposite of a grant, right? When you're writing a federal grant to do like a stream restoration project or a research project into kids with special educational needs or something like that, you have to justify all of your costs. You have to make sure that it's actually based in some information that this would probably be good somewhere down the line. You make this economic argument, and basically what they're talking about now is the opposite of that, where you say, we actually don't know how much it's going to cost, and we don't give a fuck if it has anything to do with better health outcomes, but we want to be waived out of the system, and they're just going to let you go at that point.
Right. And they've essentially created a system where there's zero accountability, because at the federal level, McConnell and Republicans can say like, well, look, hey, we didn't make the states, do that. Right. And then at the same time, the people in the states have to just say like, well, by cutting all the money, you made it, all the federal subsidies, we couldn't afford it anymore. So then we had to start finding ways to cut costs by eliminating, all these coverages.
So no one's at fault.
Well, poor people are at fault.
That's the other thing, because they kept a lot of the language that was cut by the AHCA and regarding the tax subsidies, but then they cut all of the taxes that funded those subsidies out of it. So like you said, it's they come up with these ways that they can keep what sounds like a requirement or what sounds like something that will help in the bill, but then somewhere else in the bill they figure out how to defund it.
Yeah, well, I mean, my favorite clause in the 14th Amendment of the Constitution about enforcing civil rights is the one where it's basically just like, unless the states don't want to.
Yeah.
Right.
I like that part too.
We'll leave it up to them.
Right. Because you want a federal system that basically just says, hey, if you live in a poor state, maybe a red state, maybe you're Nebraska or Mississippi or something like
South
that.
South Dakota, Idaho.
You've got all these people on this expensive Medicare. You just got to cut somewhere. You just got to cut to make it financially solvent. And that's apparently the only thing that matters is the bottom line. If they can say it's going to save money, kicking a lot of people off of having coverage sure saves money on paper.
Yeah.
Right.
But in reality, it is expensive because every time you go to a sick person and you say like, hey, you have high blood pressure and you should probably go to the doctor and get some pills to treat your high blood pressure. But it's too expensive to pay for you to have insurance. So just wait till you have a heart attack and go to the emergency room. Mm-hmm. That's not saving anyone any money. That's driving up costs for everybody because it's cheaper to get you some cheap blood pressure medication rather than waiting until you have a massive stroke and have to have emergency surgery.
Right.
It's so nonsensical. It's just like the only silver lining is if they pass this, at least they'll just be shooting themselves in the foot because literally everyone hates this. And if you think they hate it now when it's not actually happening, wait till it's actually happening. Then they're really going to hate it.
We'll have a Democratic president by that point, and Sean Hannity will just
then it'll be his fault.
Right.
Yeah.
I think one of the most ridiculous things that was said was that Mitch McConnell reportedly said when trying to convince people to vote for this bill in the Senate that, look, our choice is to either vote for this bill to replace Obamacare, or if we don't do anything, Obamacare is going to magically turn into single payer, which is the most backwards nonsense. He must realize that if he wants a single payer system, this is a great way at getting it implemented by repealing Obamacare and making a much worse system. Because if he just let Obamacare stand, maybe people would be mad that Republicans promised that they were going to get rid of it and didn't. But Democrats wouldn't be powered up to say, like, we need to fight on this as a number one issue to relitigate healthcare again. Mm-hmm. But if he passes this, that is 100% assured to happen.
For a while this year, I was doing a radio show on a local talk radio network. One of the days of the week, there was a show after my show that was hosted by an insurance guy. He talked about the ins and outs of insurance. He talked about the things that people needed to do, or he would also advocate for that religious, I don't really know what it was, some kind of weird pool that's kind of like insurance, but not quite. But his thing is he believes that all the Republicans also want single payer and that this is all some sort of big ruse. And I think that that's the funniest thing I've ever heard in my life.
Oh man, that is drinking the neoliberal milkshake right there.
I know, that is just like,
that's
right,
incredible.
bud, man.
Yeah. I
didn't stay for his show, so it was at one point where he came in and he was talking to me in between some breaks, and he said that, and that was just, I entirely wrote off everything that this man said from that point forward, because I thought that was just the best thing I ever heard.
Right. I mean, I'm fully waiting for the day when all of the Trump fans just totally flip on Trump because he becomes so unpopular that they just start saying like, well, Trump was really like a Hillary supporting Democrat the entire time.
Right.
Yeah.
That's the only way it's going to happen, too, because they're certainly not going to go against him on, like, issues or values.
No, they don't have those.
Right. I can't wait for, like, the Mike Pence attack ads against Trump or whatever. When he's trying to get him to resign. It's gonna be beautiful.
Man.
I'm Mike Pence, and I approve of this, but nothing else.
Yeah.
All right, so, before we take a break from our healthcare discussion, maybe come back for a high note, I just want to say, Peter, you expressed that you wanted to make money from your work, which I believe makes you a bad leftist.
Yeah, it does.
Okay.
What?
All right.
It makes me into a hypocrite.
Uh-huh.
I'm actually working on a documentary on that subject, like... they like to say things about how, if you have critical thoughts about capitalism, you shouldn't have an iPhone and stuff like that.
Yeah.
Like, you shouldn't make any money off of Patreon if you think that socialism or social programs are a good idea.
Just because
It's like,
Chapo
wow.
Trap House promotes leftist ideas, it's not okay that they make like $200,000 per year off of their show when there are like a million other reasons to criticize them.
Yeah.
they
Well,
make
you know,
that in, like,
I mean,
4
that makes
months.
more sense to criticize them for it. Just trying to exist in a system that demands you make money in order to survive.
Right.
Right.
Obviously.
You're survivalist. Don't worry about it, dude.
Right.
It's all good.
I mean, I think, you know, what shows that position is completely hypocritical is that when people actually did that and they went and lived in like hippie communes and stuff and actually did just say like, I don't want any part of this system, I'm going to go leave, they were still mocked ruthlessly for it by right-leaning people anyway.
Yep.
So, I mean, it's not like they're going to respect you if you're like, well, at least they have the courage to, you know, live their convictions fully or whatever.
Right.
They're
Yeah, they
not
just-
going to give you
They
any
just
respect
try to
for
paint
that
them all
either.
as nudists.
yeah.
Yeah, well, and
They
I
have
mean,
a commune, so they're all nudists.
an
Just
even
a bunch of
easier
sex freaks.
criticism that nobody seems to want to make it is all of these lanyard fucks from these think tanks. Like, they're all super white, like privileged people who went to exclusive schools. You know, these are easy arguments to make.
Yeah. Yeah, I actually make internet content and I don't have an education. So there's no falling back on like some sort of intellectual thing for me.
Right.
Well, you know, when Trump came and visited Iowa, one of the Republicans there opened up for him and started talking all kinds of shit about Ben Sass and saying, you know, because Ben Sass was going to come over there and do a thing, and was like, you know, he comes across this Missouri River with a sanctimonious attitude, and, you know, started, you know, ripping on him for being intellectual. And again, it's like, if you don't love everything about Trump, you can stay on your side of the Missouri River.
Right.
And it's just like, what?
Right. Which Ben Sass's example of intellectualism is that he literally wrote a book that was like, millennials are bad. Like, that's his level of
To
intellectual
be fair,
discourse.
that's pretty smart.
But he did study at like Oxford and then also went to Harvard and has a PhD.
He wrote a dissertation, which I read because when he declared his candidacy, I was like, I should figure out what this guy's about. And his like PhD dissertation or whatever was like, Madalyn Murray O'Hair is evil and Reagan's gonna take over the world, yay!
Really?
That's his PhD paper is
Really?
basically entitled that, yeah.
The face
Man,
of the Democratic
I didn't realize
Party.
it's that easy to get a PhD. Yeah.
Yeah, I mean, that's a pretty clickbaity title.
Yeah. So,
He's been on this millennial train since the beginning.
right.
He was way ahead of his time.
Oh, man.
Reagan is going to take over the world, not clickbait.
Yay.
All right. Should we stop that there?
That was perfect.
Yeah.
All right.
Should I
Alright.
stop the thing? Okay.